Hi, we're live. Now, I'm still figuring this out. Give me 1 second here. It says once you're live, I'm just waiting for my colleague Taylor Bean, and so I'm gonna hit this plus, and we'll just wait for her. I'm a minute early, so we'll just be on the lookout for her to hop on. And I hope everyone had a great weekend. I did have a pretty good weekend, actually. Just recovering from my sickness, recovering from, well, just being a human on the planet. It's kind of challenging at the best of times. So I look forward to this conversation with Dr. Taylor. She will be here imminently, and we will have a really heartfelt, I'm sure, and expansive discussion about some mental health things. And Dr. Taylor is really into pediatric medicine, and I see she's joined. So let me go and do this plus thing. We'll see what happens there. It always takes a minute, I think, to connect. There.
There we go.
There we go. Hello.
Hi. Hi. Always the awkward Instagram, like few seconds trying to get in process. I'm here. Yeah.
So listen, I wanted to thank you so much because we planned this like quite some time ago and lining ourselves up. But I just wanted to mention that what we're going to talk about today might make people like go or question themselves, and so you know what, that's a good thing.
Yes, it is. Yeah, I hear some things you didn't know before, didn't know to ask. Yeah, exactly. Yeah.
And you only know what you know, right? You don't even know what you don't even know. But some rules of engagement here, rules of engagement. Taylor and I are showing up with compassion, with love, with consideration, and we ask you to do the same. Okay? So there's no, again, get curious. If we say something that kind of tweaks you a little bit, get curious about that. Don't lash out at us because we don't need that. Okay? We don't need that.
No, let's keep this Monday morning chill. Yes. Yes.
So
awesome.
Go ahead. I'm going to ask you to share a little bit. And then, I think I was so curious. I mean, I love all your posts, and there was just one recently about neurodivergence. So we can springboard off of that. And yeah, just go ahead.
So I'm Dr. Taylor Bean, a naturopathic doctor here located in British Columbia, Salmon Arm, and I'm a mom of two. My getting into pediatrics was never something that I wanted originally to get into. It was more, chronic disease, and I wanted to work with athletes. That was sort of where I wanted to go. And then I had a child. So it completely changed my world. And birthing my son, he was born in Singapore. That was really the springboard of where informed consent came for me, is birthing my son. And we think we all understand what informed consent means and what it encompasses, and automatically it will be provided to you in every angle possible in every situation. And that just, it isn't the case. Be it your provider doesn't know what they don't know, and they're not going to offer that information to you because they don't even know the information to offer to you. So I had gratefully I graduated a year prior. And so I came with some obstetrical training, and when it came to my labor choices. So the obstetrician is still an incredible obstetrician in Singapore. I had a home birth, which isn't common in Singapore, a birth in a birthing pool, and a doula and my husband by my side. So it was an incredible experience. And, I did it with, I used all my tools and did hypnobirthing, and he was for all these things and wanted me to have a doula. And so it was just, it's like, does every woman know in the birthing world what's available to her? And so, because I was scared to give birth and went in it with that framework, and then did all the positive reading and came out of it feeling like a newborn human being, and that every woman should know what's available to her. So that was the springboard for me of informed consent. Now in Singapore, there are
talking.
I'll keep
Keep
going.
talking. I'm not leaving. Keep talking. I'm just
Okay.
shutting my thing.
In Singapore, there are mandated vaccines. They have measles and diphtheria are the two mandatory vaccines in order to enter school. So I'm learning this as I'm there, and now I have a child, and so people are now coming to me to ask me questions about vaccines. And then I had two families, two totally different occasions, that came in asking about potential adverse reactions to a vaccine. And I'm a new grad. Grads think we know everything, but we really know nothing. So I was like, oh, I can figure this out for you. What is it that I'm dealing with? I had no idea what I was dealing with. I didn't even know an adverse reaction could possibly ever be on my radar or anybody's radar. And in Singapore, you can see specialists within a few days, and they had the care model there is incredible, and you can get an MRI within a few days, et cetera, et cetera. So they had seen specialists for their children, these two different cases, and they weren't getting any answers. So they came to me. So I was like the new kid on the block. I should have, I'm a naturopathic doctor. I should probably have some answers. And I had no answers. I didn't even know what I was dealing with. I didn't even know, that a vaccine could create anything other than elicit an immune response. So what did immune response mean? To me, it was just make an antibody. But there's more to that. And I didn't know that, of course, at the time. And it felt like nobody knew the answer. And I was seeking these answers more so for solutions for these patients. And the second time, the second case that came in, to me, it was like, okay, I have no idea what I'm dealing with. I have no answers. And I felt really embarrassed about it. So that became, and still is, mission of mine to have every single answer possibly when it comes to around the arena of vaccines. And that was over 10 years ago. So I'm still very heavily in the vaccine world. When we moved back to Canada, I took the course to be able to administer vaccines here in British Columbia, because here we can offer as naturopathic doctors vaccines, and I do. I want to be part of my patients' world when they have to, want to, need to vaccinate. I want to be a part of that. And if that means me administering vaccines, that's also what it includes, and I do. And then for any kind of question, if there are a potential adverse reaction, what does that look like? What does that entail? What is the solution to that? What are we dealing with? Can we prevent them? Are there certain people a little bit more vulnerable to an adverse reaction? What if you have an infection? What if you have pandas? What if you have Lyme disease? What does this mean? So all of this is where my work has gone, or where I've been led down. This was also not thought this was in my future. And so, but it's become a joy and a passion, because vaccinating also encompasses psychology as well. And that part I didn't realize I enjoyed so much, in terms of being a support or shoulder for parents to lean on, because I've dealt with parents that have two different ideas, parents that are going through a divorce, and it is vaccinating that is the number one sole component of that divorce that they can't agree on. It's the only thing they can't agree on. And the child is in the middle. And so it is then navigating that with parents of what is the best case scenario for the child. Is this a case that one parent is using against the other? And that's been happening. And so again, it has to boil down to what's best for the child and bringing that back to that centerfold. So it's been really interesting navigating this with parents, because sometimes it's more than just a vaccine. And it has torn has torn relationships apart.
Mhm.
Because I have been in this for so long, I would say, creating the vaccine webinar series has allowed for, I've had couples who haven't decided to have children yet now to get into understanding vaccines.
Mm.
And it's brilliant because it's preventing animosity and argument in the future.
Yeah.
And I've had lots of parents who are in their first pregnancy, their fourth pregnancy, and it's like, okay, we need to discuss this. And it seems like something that we now are questioning, and we want to have more, we want to have some answers. And sometimes the questions can be simply, can the MMR be split up? Or tell me more about infant immunity. Or is there something I could do? Last time my kiddo had a fever post-vaccine, do I need to use Tylenol or should I use Tylenol? So there's all these little tiny components that I think in the big picture can create a positive outcome for them, for their relationship, and for what's best for their child and their scenario and their situation. And a lot of parents that are coming to me because they're traveling to Europe, lots of questions around measles, and never thought of it before, and it wasn't in their face before. Social media does a really great job of informing you of things that are important, or they're the same importance as they were 20 or 30 years ago, but seem to be even more important or scary today, which they don't need to be, because it's the same thing over and over and over again in terms of infections. Measles back then is still measles today, and pertussis then is still pertussis today. So
Mhm.
why does it get so much attention?
Mhm.
And therefore it's on your radar more because you're hearing it more and more. So now they want to land in an office speaking to someone that will give them the space to speak, versus going in an office where someone might shame them or gaslight them for even having a question about a vaccine. And that is
Mm.
probably the number one reason I'm still in it,
Mhm.
because of the stories that I continuously get from parents when they come in and they recite what their healthcare provider had just said to them. If they don't vaccinate their child, quote, their child will die, which is not evidence-based, ethically correct at all to say to a parent, because you don't instill fear, you use evidence-based medicine to have a
Right.
conversation. And so there's a lot of emotion behind this subject. I think that's why I also like it,
Yeah.
because to remove that emotion has taken me a long time to do, to show up unbiased to parents. And I do that. That is my mission, is to show up unbiased to them. It is completely their decision, their scenario, their life, their child, and what's best for them. And we're going to get there.
Yeah.
What is best for them? And that's just not out there. It takes a lot of work to get there, meaning we might have one consultation or you read one book, and it's just however hungry you are for information, we'll get there. For some people's journey, it's the beginning, sometimes it's the middle, maybe it's the end, and they just need a little bit of more information to confirm. And so it's just, it's been, yeah, every scenario is different, every situation is different, every person is different. And I always, someone stumps me with questions, and it's like, that's a good one,
Right.
actually.
Right. Right.
Thank you for that. And so I think that's why I love it so much, because it's always different. And when someone leaves the office, or, someone listens to this today and they're just like, you know what, I just needed to hear that. I just needed to see that someone allows the space in this conversation, is like, that's, to me, is massive. That's my dopamine hit.
So let me springboard off a couple of things
Uh-huh.
that you said. So, and there's lots of things that you said that I'm going to touch on. So the first one is this tension within relationships that can arise. So I'm obviously a naturopathic doctor. You are a naturopathic doctor. I'm married to a naturopathic doctor. We have a child.
Yep.
Now, the other interesting thing why I think I love Taylor so much, there's so many reasons, but I also started off with my goal is sports
Yep.
medicine. Right?
Oh, really? That's awesome.
I don't do sports medicine at all. Never got to sports
Yeah,
medicine.
never got there.
Well, I had two main goals: mental health
Yeah.
and sports medicine. But anyways, I got pregnant right away. Boom. So that then sports medicine out the window, and fertility, women's health, hormones in the window, because I was 40 when I had my child. So let's go to this conversation. I felt like I am going to go through pregnancy, perimenopause, and menopause all in the same year. But now that did not happen because I still am not in menopause 19 years later, but here we go. But what did happen, and this pertains to the conversation we're having, is the discussion about vaccinations for our child. And I was in the, well, I got them. I seem to be okay.
Yep.
How bad can they be?
Right.
And my husband was very much, and I don't think he likes when I tell this story, but it's my experience, so I'm going to share it. My husband is very much, was very much in the anti-camp. So there you go. Two naturopathic doctors, seemingly similar philosophy on opposite ends of this vaccine conversation.
Yeah.
So then I said, okay, well, so for me, relationships are all about compromise and communication. And conflict illuminates the fact, like if you really are going to divide over a conflict, then that is illuminating the fact that your relationship actually wasn't that healthy. Because in a healthy relationship, the truth of each of us is welcome. We're not coming to the conversation to win an argument from the ego. We're coming to seek clarity from the heart, right?
Right.
So long story short, we ended up vaccinating our son for, but only with DPT. And guess what happened to him? Healthy kid. Next day, not even next day, within hours, sitting there, eyes rolling back in his head, drooling, listless, fever, wouldn't eat. He's pointing at me with blame. I told you we shouldn't have done it. Look at what you've done. And I'm just like, holy moly, what's going on with my kid?
Right.
Where's my kid?
Right.
Okay, so you can get in that blame, and that, and I'm like, you know what? We don't have time for that. We need to fix this.
Yeah.
So he got out the research books. I got out the research, what we could do, and we came across these protocols, learned about adverse reactions. I even had a nurse patient of mine, medical model nurse, who I shared with her this story. She goes, Chris, you needed to report that.
Right.
I'm like, oh, I'm supposed to report that? Like you said, we didn't get taught this.
No.
But it happened to me with my kid.
Yeah.
So very scary as a parent. I got to tell you, very scary. Turns out those were seizures. Turns out that, well, he's fine, 19, he's fine. But wonder what would have happened if we continued down that path.
Right.
Right.
Right. Yeah. Yeah.
So all that to say that, you know what, the toxic burden of a person is really important to understand. And nobody's talking about this.
Right.
When you're pregnant, depending on how many years you've walked on the planet, we're all toxic.
Yeah.
Story.
Absolutely.
Right?
Absolutely.
I did a year-long detox before I had my kid. But, our children are being born with their cups, their toxic cups already full.
Yeah.
Already full. Then you add some antibiotics or insult to injury, shitty food, whatever. And then now we've got this whole neurodivergence conversation.
Yes.
Right?
Yeah.
And I'll say one more thing. I mean, a lot more I want to say, but the other thing I wanted to mention is I babysat in 1979. I was 12 years old. I babysat an autistic child.
Oh, interesting. Yeah.
Nobody was using that language at the time. And I knew her name was Pamela, and I knew that she was there.
Yeah.
I knew she was there. And I liken it to myself in my psychotic events. I'm still there. Essence and soul and spirit of that person is still there within them. They might be locked up, they might be covered up, but they're there.
They're there.
And how can we reach them a little bit? Because let's face it, the incidence of these conditions are on the rise. And I'm talking every mental health condition under the spectrum, all of them.
Right.
And that infuriates me.
Absolutely.
Yeah. So
yes.
Go ahead.
So
there you go. I'll stop there.
Totally. So my last post that I wrote on Instagram,
Yes.
because it was bubbling. Although Robert Kennedy Jr. is what created it, and then a big kerfuffle as a result. And so he said in office, he said by this September 2025, he will find the cause of autism. And
Oh,
that,
I was wondering what this
yeah.
kerfuffle was, because I'm trying to get off of all this. So
Yes. So
so I
that's the
look to you.
kerfuffle.
I
Oh
look to
yeah.
you to guide me.
So he really
You
ruffled some feathers.
did. You did.
And so what came out of that, of those that are on the spectrum, took great offense to that and said, how dare you? And there's nothing wrong with me, and it's genetic. And so, I had he known by being videotaped and the clip that would have gone out, he would have more elegantly had used his words and said, I will find the cause of profound autism. ASD, autism spectrum disorder spectrum. It's a spectrum. And so width and depth to this spectrum. And with the diagnosis of ASD, be it even the 80s, was just first off identifying that we even had, autism, what that was, give it a name, because in medicine, everything has to have a name to it. So when you're writing your chart notes, just know that you have to have something from the DSM, and you have to use a code in order to complete your chart notes. You can't just say
And get paid.
and get paid. So you can't write in your chart notes of your assessment, FYI, you guys, inability to talk or not looking at me. You have to use a definition, an actual assessment name to the person that which you are treating. And some conditions that will label people are pretty broad and useless, like IBS or fibromyalgia, but those are a diagnosis, and then you can sign your chart and you're done. Because fibromyalgia is just pain, and what's the cause? It doesn't really matter. Or IBS, I mean, there's a cause to that, but we can label as such because of these are the objective findings. So now autism is starting to from the 80s, now 90s and 2000s, starting to morph a bit more and better. And now we're still spectrum, but now there's categories, 1, 2, 3, and then subcategories to the autism as well. So in Canada, if you want your kiddo to be diagnosed with PDA, pathological demand avoidance, it will be under ASD, for example. It's not a solo diagnosis on its own. In order to get that sub, you have to be the whole arcing of autism, and be it today now in Canada to get, and per province, it's going to be different in each province, but once you get the diagnosis of ASD, you will be given care. So without the diagnosis, you do not get care. You get
funding.
access and funding.
Yeah.
So there's part of you or I that wants that diagnosis for your child so that you get access to OT and speech, ABA, etc., and EA at school. You will get help.
Yeah.
That's what the umbrella term gives you. So the patients that I see in my office are on the profound end. I have, of course, variants within the spectrum and diagnosis, but I've see a lot that are on the profound end, which Kennedy is talking about. And that profound end is where we're going to have children that seizures, they can't speak, they can't write, they can't read, they have insomnia, be it their manic episodes, but their OCD. There is a lot going on now. A lot going on. And so we always go back. And I want give me a full lineup of every event, starting from pregnancy, of what's going on. And when did you see the change? So there's usually a time period that parents can identify, typically a time period, not always, they can identify. And it doesn't necessarily mean it's around a vaccine, but I will say always with children is that there will be encompassing in this is, be it C-section, typically breastfed, but maybe only to 6 months. Yes, vaccine 2, 4, 6, 12, 18, because that's our Canadian schedule. Antibiotics, and there was definitely Tylenol use within that. So we have, in terms of C-section, you are missing very key microbial species by way of going through the vagina. You're going to miss that. And that affects immunity is what that does, unfortunately. And if you were GBS positive, then you as mama, you were on an IV antibiotic through the pregnancy, and be it you did a vaginal birth, but still exposed to antibiotics. So we're really affecting our microbial species that affect immunity and mood. Then vaccines at 2, 4, 6, usually with Tylenol, either pre or post, you're given. And usually between the 2, 4 or the 4 and 6, there's an antibiotic in there as well. And then you get to 12 months and you have your MMR, which also includes PCV13 and pneumococcal. So you get 3. And usually there'll be Tylenol, and that's be it. They see something happening, but not usually till maybe 18 or 2 years we're seeing something. And it could be coming after a naturally acquired infection or not as well. But there is multiple components that always are happening in all of these children that which present with profound autism. Profound autism, I would say it's not autism either. I will go out there and I will say that. What we're dealing with in these children that have seizures, be it loss of speech, insomnia, like there's so many components going on here, are dealing with neural inflammation. So you have neurodiversity and then you have neural inflammation, and there are 2 totally different things. And that is what, be it Kennedy will speak to in September, but that 100% will be part of the conversation, because when you create neural inflammation, you are going to start creating changes in neural development. And so vaccines, because I have children on the spectrum that are unvaccinated. So we do want to, everyone wants to pigeonhole vaccines in conversation, but those kiddos that weren't vaccinated, bit by a tick, antibiotics, vaginal birth, maybe not breastfed. Nutrition is okay, not so much. But trauma isn't, sometimes trauma is involved and sometimes trauma is not, because I go there in terms of birth trauma and homestead trauma as well. And so while that might be added to the cause, it also isn't always, it isn't a big component. There's usually things that have been done that insult to neural development. To vaccines, they are inflammatory by design, and they have to be inflammatory. That's non-negotiable. They are. In order to create immunity, you have to create the whole sequence of making immunity is inflammatory. And that is why infants are born not being able to make immunity to infections, not till around 9 to 12 months, because it's inflammatory. That's why they can't. They're not born being able to. Through breast milk, mother is providing antibodies to protect baby. That is what nature intended for baby to be protected. You are providing the antibodies. So infants are born, so we'll get a little bit technical. Infants are born with what's called Th2. They have their T helper cells, Th2 helper cells. Th2 are responsible for making antibodies to food proteins. So baby's breastfeeding, mama ate a banana, she ate some gluten, she ate some egg. Baby is being exposed to these things via breast milk, and baby is making memory to those things. For the first 6 months of life, babe is just getting things from mom, making memory, and learning self from non-self. So when breastfeeding happens at 6 months, or when food introduced rather at 6 months and a little bit of it, babe's already seen that, seen a carrot, saw those things in their mouth, or physically getting it. So the baby's body doesn't have to over respond to that food, because it's like, I've seen this in the last 6 months. And so now food's being introduced. And so with that, a transition starts to happen around 9 months, because breastfeeding reduces, food increases, and the baby realizes that it's getting less memory from mom. So we should probably start making our own memory.
Mm.
Now, from birth, Th1 was what we need to make memory to viruses and bacteria is completely shut off. And there's two ways that this happens. Via breastfeeding is one way that through breast milk and breastfeeding, the action of suppresses Th1. But primarily Th1 is suppressed by what's called interleukin 4, IL-4, which is part of the immune system, but it's circulating through the body in an infant to help with memory and cognition development. That's why IL-4 is there, and it's helping because the first year of life, I mean, there's a ton of stuff going on. So IL-4 is secreted in high amounts, and that completely suppresses Th1, and it holds it down. It is not arising. Th1 is blocked by IL-4. So the infant has zero ability to make memory. It cannot. Now, with vaccines, what happens at 2, 4, 6 months is we're using vaccines that contain aluminum. It's an adjuvant. So aluminum's primary sole goal is to stimulate Th1, is what aluminum does. So we have to awaken Th1 very mildly at 2 months because Th1's like, what? And then goes right back to sleep. And then we do it at 4 months. It's like, okay. And then back to sleep it goes. At 6 months, we've woken it up again. It's kind of like, okay. It's like waking a bear up. It's like, okay, I'm awoken. I'll make some memory here. And be it I'll stay awake or be it I'll go back to sleep. And then we repeat everything that we've done at 2, 4, 6 months at 12 and or at 18. And now we're doing it in a time period that the body knows what to do with that. Research understands that there is a locked-in Th2. It knows that. They know that there's a locked-in Th2, and they're trying to find more novel components to awaken Th1 in infancy. This is not new information. They completely know that. So that always is a question is, should you be awakening Th1? Should you be doing that? If it is shunted by, because part of me thinks, well, if you were to pull away IL-4 to awaken Th1, what does taking away IL-4 do for the baby that's need for memory and cognition development? Now what are you doing if you do that? And does awakening Th1 in infancy suppress IL-4 for a little bit? Does that impede neural development as well as that action is there, which shouldn't be there? And with the inflammation, an infant doesn't know what to do with the inflammation. It is not prepared for inflammation yet because it's not supposed to be. So when we awaken Th1 at 2 and 4 and 6, then layer in Tylenol, which is a terrible idea. And if you take anything away from today, please throw Tylenol away completely, please. That's paracetamol, that's acetaminophen. You want to get rid of it. So what happens is that Tylenol or acetaminophen breaks into a very toxic metabolite, which is glutathione dependent to continuously break it down. So the body makes glutathione all the time from homocysteine. We do this. But if you use up that glutathione in that dose that you just used, and then you use Tylenol again and again and again, you just got a vaccine, inflammatory. Then you added the Tylenol because you're dealing with, I don't know, there's hand gestures happening.
Oh, okay.
Yeah. And so then you add in Tylenol, which if the baby's body cannot break down glutathione well, it will then maintain that very toxic metabolite, which will go to the brain. And this is understood about Tylenol. This is also not new information. So then you combine them both together. So you've suppressed the fever post-vaccine with Tylenol. Now your baby's not feeling very good. I'm not sure. They're still like, now maybe we're vomiting, we have diarrhea, and you go to the doctor. Like, oh, okay, well, let's try an antibiotic. So you do an antibiotic. You do as you are told. And so not either of you, unfortunately, yourself and your medical doctor, knowing in terms of infant immunology and what's going on about the physiology at this point of what's happening and what potentially could lead, because it's going to go two different ways. Your baby does work through it and its body works through it and it resolves. And if you're still breastfeeding, that is supporting baby. If you're not breastfeeding, this is where things can go sideways a bit more quickly because you're not providing any anti-inflammatory immunoglobulins or supporting baby through this process. And through breast milk, you also provide good bacteria as well, which come from your gut. So you're maintaining with breastfeeding, and those that aren't breastfed, they aren't being supported through that. And I would also say you're probably not doing fish oils or vitamin D or probiotics for that baby as well, because your medical doctor didn't tell you you should also do that. So it's just insult to injury consistently. And this is the storyline, the timeline over and over and over that I get when I'm working with someone with profound autism.
Yeah.
And when you've heard that someone has recovered their child from autism, guess what? They didn't have autism in the first place. That's not what they had. They were able to recover their kiddo from autism because what they did is they recovered them from neural inflammation is what they did. It's exactly what they did. So they supported brain function, and they worked with someone very quickly to help resolve the inflammation that their child's body was dealing with. And so it's a concept of putting diesel in a gas car. We're going to have big issues. And so you quickly realize you put a little diesel in a gas car, and then you're quickly going to fix that and be fixed parts. But when it comes to the baby's body, we'll fix the brain and the inflammation that's affecting it. And we can get on that really quickly. Then we're going to have really good resolution is what we're going to have. We can create harm. We can. And when we understand that and we're open to having that dialogue that we've created harm and what the harm is, then we'll be able to find the solutions to support that. And or we can also, so when I work with patients in terms of vaccinating, I'm going to use the tools that are going to mitigate that possible inflammation as well, pre and post as well. And so, be it you have to, want to, need it. I am there for all of those people. And do this in a really good fashion because I understand the potential of what could happen. That information I know and have. And so we tweak and work with what we know to prevent, because it's do no harm. So I want to prevent knowing what I know potentially could happen, and that we are all this has been since I've been home now from Singapore 9 years, so almost 10, which is crazy. And I've been working with families that long in terms of, and I have, knock on wood, I have never reported a vaccine adverse reaction with any of my patients. And they know, I can give them and will give them the 3-page adverse reaction reporting that comes from the BC CDC that I am supposed to give to them if there is, because on an annual basis, vaccines get looked at to see if there's any trends to be pulled. And they did that with the rotavirus and the DTaP. And so I will be I will report it, but they've never had to report it.
And I think that speaks to one of the important points that gets missed in the conversation about our role as naturopathic doctors, because our role is essentially, and this is what I say to my patients, look, if you choose to vaccinate, I support you. And I support you through that process, just like you said. If you choose not to, I'm going to support you through that process. And if you do vaccinate and you have an adverse reaction like I did, I'm going to support you through that too. So I've got you covered. My opinion, my personal opinion is out, because that's bias. And you started off saying, we started off this live saying, we want to come to the conversation with our patients as unbiased as possible, recognizing that is pretty much very difficult to do 100%.
Oh yeah.
But we do our best. And the other important thing to take home here for people who are listening is that we are complex beings. I watched a documentary many years ago by David Suzuki called The Autism Enigma, and he was highlighting an important point, which was the overuse of antibiotics in the first 6 years of life, which I thought was brilliant. I'm grateful for that, for his contribution. What he missed is what Taylor was talking about. We did an autism conference here in Edmonton. This is back in 2010. And one of the things that was highlighted across not 100%, it wasn't 100%, but it was very high percentage. 70% were C-section. This is something that Dr. Bean has mentioned. So now we've talked about this. This is a very important piece of the puzzle that's not getting discussed.
Yeah.
So again, not saying not to have a C-section. I'm saying do that vaginal swab transfer. But the other important point that has been made is if you were positive for GBS, chances are, do we want to do that transfer? Probably not.
Right.
So, so what we do with our patients, we are preconditioning them in pregnancy, supporting them throughout their pregnancy, hoping that I have a very, very low C-section rate in my practice. I have a very low rate of autistic spectrum children in my practice. My husband sees children on the spectrum. I see every other mental health condition except that. He has that base covered.
Awesome.
And he sees it time and time again. Everything was developing until something, until something. And it's not just one thing. And that's the problem with medicine. They're looking for the one magic bullet. There is no one magic bullet here.
Absolutely.
Right?
Yeah,
You've mentioned
yeah.
Tylenol use. You've mentioned breastfeeding.
Yeah.
So it's really multifactorial. And I think that's what's important to understand. Yeah. And that it's not a crime, or it's not. What I find is that people are so sensitive now.
Right.
And listen, I'm on my own spectrum. Okay. So like, I get it.
Yeah.
But I also, as I wrote in your post, I said, but look, I continue to look for answers because I kind of, and I don't like the word normal. Okay. Let's throw that word.
Right. Totally.
But
Totally.
I do like the word functional. I do like the word contributing.
Yeah. And to me, in the children that I work with, is I want them to reach their genetic potential. I want them to be thriving. And if there's anything that's gotten in the way for that, identify it and remove it. And so if we're affecting neurological development, expect a problem. And they've done this in rats, where to prove autistic-like behavior, where they have injected certain metabolites into rats, and then they get rats that are standing in a corner, not engaging, not socializing. And so it's like, okay, so you created insult to brain function is what they did. And so then they blocked off a particular part of the brain that would otherwise they would be engaging. And so we as humans can do the same thing. And so we want to label it as autism, but to me is, well, maybe there was an insult to injury here. And because when you label a child, or we go down the path of wanting to label, sometimes that closes doors for you, is what happens. Yeah. If child was labeled with mild encephalitis instead, now you have a solution. Now you have to create a solution. You have to fix that. But if you label them with autism instead, because you're not looking or understanding for signs of mild encephalitis, then that's it. Case closed. Here's your funding, and go see an OT. And to me, that's not good enough. And so if there is insult, this is where we get into pandas pans, which is starting to be more recognized here in Canada. But know your kiddo has a tic and OCD. It could be caused by an infection. And so let's fix it. Let's get rid of the infection. Oh, look at the OCD is reduced. Look, the tics are reduced. It's not a defining moment for your kiddo, is that they are OCD and that's it. Right. And instead now we have to go on an SSRI. That is not good enough to me. So that's why the journey of getting more answers, there is nothing wrong with that. And or if you feel your kiddo is thriving and meeting their genetic potential, hallelujah. Right. Fantastic. And if not, let's know that there is another door that may open for you of other things. And search those. Get some answers and do a timeline. Always come with it. Look at the timeline. What happened? A, B, C, D, E. Oh, okay. All right. Well, now you got something here tangible, and we can work on that. So, it's sometimes it's not just A, it's not just B, but it's A plus B plus C plus D equals Z. Right? So it's this exponential impact. So it's not necessarily this is one thing. And it's this concept of obstacles to cure. Yeah. Right. There are many obstacles to cure in our journey. Whether, if it's your label is autism, or it's bipolar disorder, or it's bulimia, there's many obstacles, or if it's just migraines. I mean, fertility, whatever it is. Yeah. So I think this is, of course, where it's near and dear to me, right? Yes. To be beyond the label. I love it. And that doesn't chronicle necessarily
the conversation about autism that we're having, but it does chronicle pretty much every other, and it's still applicable. Still applicable. So
Absolutely.
yeah,
Yes.
any final words of wisdom you want to leave?
I just want to thank all of you for showing up and listening. And I hope I, planted a seed for conversation, even in your own head or maybe with your partner. Yeah, I think that we can, shall I say, have our cake and eat it too in every circumstance.
Gluten
But
free,
if, yeah,
sugar
yeah,
free, gluten free,
sugar, gluten free.
dairy free.
Yeah,
That's what
definitely
I
not
get
egg,
from my.
definitely not egg free.
Yeah, yeah,
Always the eggs.
yeah,
I'm biased because I have chickens, but
yeah.
so just you're not wrong when you have an inkling in you and you're searching for more answers. You're not wrong. I think we are curious by nature as humans, and always be curious, always ask questions, and don't feel that you can't, because you can. And if someone can't answer your question, I want you to know it's because they don't know the
Right.
answer. And if you get pushback, it's because they don't know the answer. They want you out, and you are making them feel uncomfortable because they don't. We were trained as naturopathic doctors to be curious. That was our training. And so I'm not trained to be like, well, if your patient doesn't know them, even if they're asking you questions, just skirt around and get them out the door. That's not how I was trained. So I love it. And again, that second family that came in, and I literally felt embarrassed, is the sensation that got over me. And I was like, okay, well, then I will know the answers at some point in my life. And I still don't know all the answers, but it's getting closer in terms of me understanding what it is that I want to know. And to me, that's big, massive headway, and more people are talking about neural inflammation and immune activation and what that means, and how we support kiddos through this, and adults through vaccines particularly. But no, I mean, I my Instagram is where I like to post all the fun stuff, and that's where you'll see it, really nowhere else. I do have a vaccine webinar series, vaccineoptimization.com. I am beginning in its infancy writing a journal to go coincide with those webinar series, which will have more nuggets of information in it, because it is a journey. I really do. I don't think it's a watch 3 webinars and we're done. No, I really do think that it's a journey. And as I tell all my patients, it's your decision, and I want you to be able to make the decision on your own. It'll never be, well, Dr. Bean
Right.
said. No,
Right.
it's, I made the decision because my child, we live here, we're doing this, do or don't. You made that decision. And I never give people alternative vaccine schedules ever. I meet you at the table with you, and we discuss, and we go from there. And sometimes it's going to take a few discussions for us to get there. So there is no, be it for you, one size fits all the time, because guess what? Vaccine schedules are different everywhere. And in different provinces, different states, different countries. So there is not one size fits all, actually, because everyone does things a little bit differently in the same risk factor locations too. So yeah, I think that's covers it all. Thank you for having me. This is awesome. Yeah.
Yeah, and I think definitely if you have questions, check out Dr. Taylor. She does, like she said, she has courses. I have courses that will be launching as well in the fall, and for clinicians in the new year.
Awesome.
So our mission is to doctor is teacher is one of our principles, and another is do no harm, as was mentioned. So it's really incumbent upon us to not only obviously give to our patients, but we want to give to clinicians, because a key point, when you graduate, you might think you know it all, but you actually don't. And that's, I've felt the same way as Dr. Taylor. When people ask me questions, I don't get like, if we can get in our ego and be like, all, however, but I'm just like, wow, that is a great question. And you know what?
Yeah.
I don't have the answer.
Yeah.
But I will look for you.
I will look for you.
Yeah, I will look for you.
Yeah.
And that's all we can
Yeah.
do, because not one person has all the answers. So because we don't even know the right questions to ask. So how can we even know that we've got the answers?
Totally.
So,
Absolutely.
right?
Agreed.
So
Yeah.
we're gonna maybe we'll do this again.
Awesome.
Maybe.
Absolutely. Absolutely. Anytime. Mm-hmm.
All right.
Yeah.
Well, I got to get to your farm at some point.
Yes.
And
Yes, you do. We got lots. Right now I've got turkey chicks, meat bird chicks, meat birds that are going in 2 weeks, pigs, my llama and donkeys. So there is
there's
lots
lots
going on.
going on. There's lots going on.
What's going on? It's awesome.
Okay.
Yeah.
Well, Sandy,
Excellent.
yeah, lots of love to you. I'm gonna have to part now because I gotta hop on to the
All
next.
good. Excellent. Okay. Bye, Chris.
Lots of
Thank
love to
you.
you. Okay, bye.
Bye.